Community Health Matters was made possible by a grant from the Tri-City Healthcare District Board of Directors Community Healthcare Alliance Committee.
Welcome to Community Health Matters. Glenn Newhart and Sharon Davies are here to share some exciting details about the renovation of Tri-City Medical Center's labor and delivery and neonatal intensive care unit. As you know, Tri-City Medical Center is your healthcare leader in your community, with over 700 physicians in more than 50 specialties. Tri-City Medical Center is also home to the only Level 3 NICU in North County. Sharon and Glenn, welcome to the show.
Thank you, John.
Thank you.
Sharon, why don't you tell us a little bit about Women and Newborn Services and what a Level 3 NICU is?
Well, Women and Newborn Services consist of labor and delivery, mother, baby, and the neonatal intensive care. And the neonatal intensive care is where babies that have special needs or that are born prematurely are housed after they deliver. Being the only one in North County means that that we can keep mothers that are high risk also. In 2015, we delivered 2,578 babies, and we had 620 admissions to our NICU. And what it means being the only is it's not just babies that were born in our facility. We also get babies from Camp Pendleton and Balboa, the university, and Rady's when there are a lot of babies born in our service area.
Just so everyone can understand how this works, would every baby born in the medical center go through this unit, or is this for a select number of babies?
This is just a select number of babies. Again, babies that are born prematurely or babies that have medical complications.
And what's the significance of the Level 3? I assume there's a Level 1 and a Level 2?
Hospitals that deliver Level 1, they mainly take care of mothers and newborns that don't have complications. On a Level 2 facility, they are capable of taking care of some special needs, but usually if your baby was born prematurely less than 34 weeks, then you would have to be transferred to a Level 3 facility.
Would this be a situation where in some cases you know up front that a Level 3 facility is going to be needed if you are an expectant mother, and in other cases you get transferred there? How does that work?
Up front, most mothers know if their pregnancy is high risk, so they seek a facility that have Level 3 care because they don't want to be separated from their newborn. So
when did you realize that there'd be a need for expansion and renovation of this unit?
I came to Tri-City as an employee in 2012, and when I started looking at the flow of the neonatal intensive care unit, we have an overflow unit in addition to our 20-bed main unit, and when we would get to a certain level of newborns, we would have to transfer and open our overflow because the unit was built in '89, and as we're trying to promote family involvement, when we get past 13, 14 babies, the unit becomes crowded, and being able to accommodate the family at the bedside is difficult, so we will overflow to our other unit. And looking at the current requirements for bed space per baby, our unit needed to expand, not the number of beds, but the square feet per infant, so that we can accommodate those families.
Glenn, the NICU has been around for about 30 years, I understand.
Correct.
Tell us about your involvement in this.
Well, Sharon approached me on behalf of the foundation, and she said, we have a need, and do you think the foundation would consider supporting this project? And we talked about it a little bit, and she shared sort of the vision for what's possible at Tri-City. And we were able to rally the support of the foundation board members and share these ideas with them and these concepts. And they said, yeah, we want to support this. Many of them had personal connections to to Tri-City in this way, children, grandchildren being born at Tri-City and a few likely utilizing the services of the NICU. So it became a natural fit. We always look for projects that have great impact for the community. For the past 52 years, the foundation has existed to partner with the hospital and sort of provide that margin of excellence that the medical center needs. Some things that they'd like to have and maybe can't do themselves. That's where the foundation works with the community to raise the funds necessary to complete these projects.
Can you give us some idea as to the scope of this project?
Yeah, this is actually, the renovation and expansion of the NICU is $1 million project. And all the money raised for the total cost of the project is being funded by the Tri-City Hospital Foundation through support of the community. So it's generous individuals in the community who come out and support events, who make direct donations, who have included the foundation in their legacy and estate planning, that have a real strong interest in ensuring that we provide the highest level of care in North County.
Is it typical for a project like this to be totally funded by the foundation, or is this a little bit exceptional?
I think for Tri-City this is a bit exceptional, and I think what it shows is it shows the commitment of the foundation board to be involved and to partner with the hospital and to make this happen as quickly as possible. It is a critical need. As Sharon mentioned, the amount of services provided to our friends and neighbors is remarkable. And we all live here and we feel that this is something that is absolutely vital for our community. And so there's an overwhelming commitment to take on this project and to complete it as quickly as possible.
Speaking of the timeline, what was the official start date? When was this decision made?
So the decision was made late last year. We've been fundraising for it. We are to the point where construction is about ready to begin. The necessary state approvals are largely obtained. We're waiting for final approval from OSHPD, which is the state agency that governs construction at hospitals. As soon as that approval is received, construction will start in earnest with a completion date of late summer. So it'll happen very, very quickly.
Sharon, is the current unit going to be fully functional while this expansion process goes on?
Yes, it will. We have a plan in place to renovate we will be taking over a unit adjacent to our current NICU, and that space is going to provide 12 private rooms for a neonatal intensive care. And when that opens, we will shut down the current space and renovate it, and we will have our overflow available to be able to house the babies while we're doing the expansion.
Well, Sharon and Glenn, it's time for our first break. We will be back with you shortly, and we'll talk about how the NICU is important to our community. Stay with us.
This is Zoe. She's 1, and she's running for president, potentially in 2064. Because if she's kept safe and eats well, has the opportunity to learn and grow, if she has help getting ahead and support along the way, then Zoe could be president. Like her hero, Ababam Binken. Help kids like Zoe dream big. The why, for early learning, childcare, mentorship, and more. For a better us. Donate to the why at zoeforpresident.net.
I never chew tobacco.
I don't drink much.
Never smoked a cigarette in my life.
HPV. Isn't that about cervical cancer?
What does that have to do with oral cancer?
HPV? Didn't know that.
Welcome back. We've been speaking with Sharon and Glenn about the expanded NICU at the Tri-City Medical Center. Glenn, when we left for our short break, we were right in the middle of the timeline. So started about a year ago. You're in construction now, and just to close that out, when is it done?
Well, actually, construction will start shortly. As I mentioned, we're waiting for the final approvals from OSHPROD. Once that happens, construction will actually start nearly immediately. And the first phase, as Sharon mentioned, will be the 12 private rooms across from our existing NICU. That'll be complete. The unit will move across into the private rooms, and then we'll renovate the existing space. And we'll have everything open and ready for a dedication on September 10th.
Of this year?
Of this year, of 2016.
Great. Now, Sharon, let's talk about the importance of this project to the community. What are the impacts?
We live in a community of military families that they don't have support people in the area, and the impact is that they would be able to stay at the bedside of their baby while the baby is receiving care. And one of the big things that we're trying to do is support breastfeeding. It's a national initiative. So having that mother where she can stay at the bedside also makes that infant thrive. There's been lots of studies that the touch of their family causes their recuperation period in the NICU to be less.
That's great. You know, I rarely tell a personal example, but I remember as a young lieutenant commanding a unit on Camp Pendleton many years ago, one of the biggest problems were young spouses, in those days almost all wives, who were completely separated from the support unit. And we needed the community to do that. And the Armed Services is doing a much better job on their own, but we still need the community to do that support. So I'm really glad to hear that. What other positives come out of this?
Other positives that have come out of, that will come out of it is that we will be able to look at a lot of initiatives that that we want to do to make the patient more safe care for the baby when it goes home. The mother will be able to learn what she needs to do gradually on what she needs to do to take care of that baby, so it doesn't have to be readmitted to the facility.
Is this part of the core level 3 issue?
Yes,
or is this an expansion into other areas as well?
This is an expansion into other areas as well. And parallel, we'll be renovating our labor and delivery unit, which is where women labor, deliver, and recover after a delivery. And we'll also be renovating our mother-baby unit, and that's where mothers and normal newborns stay as a couplet to receive care after they deliver. The importance of what's going to be happening with that expansion is the rooms that we currently have were designed when it was thought that a lot of cabinets in the room was a good thing, and we have mocked up a couple of rooms so that we could show our supporters of pulling those cabinets out and revamping the space so that we can have our technology, but we increase the space that's available for the family to come in and during that time of birth, because for families, this is the time they believe in miracles, and we want to deliver that.
And of course, technology is getting lighter and smaller too.
Yes,
at the same time.
At the same time.
Now, are these additional renovations, that's labor and delivery and mother-baby, is that part of the same timeline and the same project?
This project runs concurrently with the NICU renovation, and actually we have the necessary approvals to do this project. We're still gathering funding to complete this project, and this will be done in phases. So as you can imagine, with many babies being born every day, we can't actually take this whole unit out of service to renovate. So it'll be done in a series of between 2 and 4 rooms at a time, based on the patient census, the number of women delivering babies. And once we get started on these rooms, it's going to take 2 to 3 weeks per group of rooms to completely renovate. So an easy way to think of it would be like when a hotel goes in and renovates a room, it takes several weeks to do that. It's a very similar thing here. And what you're going to see with the finished product is a room that's much more inviting and user-friendly, warm, feel. The woods are going to be of a color and a texture that it's inviting. It's going to feel like you're in a nice hotel, as opposed to maybe what used to be the idea of the big cabinets and all this stuff. Open, clean, very sleek lines, very nice actually. when we take donors through it, potential donors through it, they're amazed by the difference, because we take them to the existing room next door and then into the new room, and it's a night and day difference. The community will be very proud.
So it's not just a question of capacity then, it's a question of attracting people, in effect, to what I assume will be the best of its type in what? In the county, in the state, or would this be a national best of class type of facility?
I think what you'll see certainly a facility and an experience that is the best in North County. Our team is outstanding. And John, if I could, working with the NICU team and with folks in mother, baby, and labor and delivery on this whole project, everybody is so incredibly supportive. They're supportive, and they're assisting in the fundraising. They want to get involved. They're volunteering with the events. This is something that's personal to them as well. Not only did they work at Tri-City and this is their job, they want to be involved and help fundraise for this project. And I think that's something that's unique about Tri-City. We have this family atmosphere, and the care we provide is that you're caring for your friends and family. But when it comes to the fundraising, they're all in. And as somebody who does this for a living, it's amazing to see. Anything we need, anytime we need them to do it, they're involved. It's incredible.
Sharon, we have about a minute left, and I fully understand that the goal here is customer satisfaction. But something like this usually has a pretty big impact on the staff. Can you speak to that a little bit in the last minute we have?
Well, one of the things that Tri-City is currently trying to do is recruit at least a couple of more private physicians. And that's going to impact our deliveries by about 400 to 500 a year. And the impact that has on the staff is streamlining these concepts causes their job to be easier. It causes being able to assist these parents in having their baby in without having to restock a room with cabinets. We're going to go more to a case cart situation where everything that they need to do that delivery is in a cart. So and the staff is very active in working on that process of streamlining what we need to do in these new rooms. Another impact is they want to be proud of their unit. They're proud to work at Tri-City, and this will make them proud to show their department to our community.
Excellent. Well, I think you've given us a great picture. In our next segment, we're going to get a personal view on this, so you'll want to stay with us. We will be back in a minute or two.
Watching online videos like this one.
Brushing for 2 minutes now can save your child from severe tooth pain later. 2 minutes, twice a day. They have the time.
My name is Andrea Lee Greenberg. I walk for Autism Speaks because my son Tyler is the single most important person in my life. Walk Now for Autism Speaks raises awareness every time a city puts on a walk. It is a terrific way to come together as a community, to reach out to one another, to get the message out that these children and these adults are incredible human beings.
To find a walk near you, visit walknowforautismspeaks.org.
Welcome back. Joining us for this segment is Janelle Lovelady, who currently works with Tri-City Medical Center. But before she was an employee, she was a patient. Janelle, welcome to the show.
Thank you.
How about telling us your story?
I'd love to. So my history with Tri-City began in July of 1988, where I was a newborn at Tri-City Medical Center, and also spent the first weeks of my life in the NICU. And so the NICU has always been special to me, since that's where I started my life. And flash forward to July of 2000.
Oh, wait a minute. I thought you were going to tell us you remember that happening.
I don't remember.
We were going to have big time TV here. So, no? Okay.
I don't quite remember it.
All
but
right.
What I do remember is July of 2014, where I was able to give birth at Tri-City Medical Center to my daughter Juliet, and where she was subsequently in the NICU for the first weeks of her life. And so that experience, I had a wonderful and easy, uncomplicated pregnancy. I had no intention of having a sick baby and had no idea that that was even going to be part of my story. But it was, and so as my labor progressed, I could tell that the doctors and nurses grew increasingly concerned of infection in my baby. And so, of course, as a first-time mom, that's extremely frightening, and the uncertainty of what's going to happen after delivery was on the forefront of my mind. And so as soon as I delivered Juliet, the NICU team came into my delivery room and whisked her away from me and began to bring her to the NICU to start IV antibiotics and other treatments to prevent the spread of infection to her body and to her brain. And of course, it was terribly difficult and emotional, because when you carry a baby for 9 months, you just want to be able to hold and love your child right after you give birth. And when you're presented with your baby not being able to be in the same room with you, and the worry of when the baby's going to be able to go home and what the timing of my discharge from the hospital was, it was all very frightening. But what I learned over the next weeks were that the staff in the NICU, the physicians and nurses and the support staff, really became my family, and they were able to offer me support and love and care for Juliet the same way that I would care for her at home. And so I'm forever indebted to the staff in the NICU for providing care for my daughter. And this whole experience left such an impression on my heart that I decided that going forward, I wanted to build my career at Tri-City. And so after I was done healing and on maternity leave, I decided to start my career at Tri-City so that I could further support the organization and support the NICU renovation efforts, so that everyone in the community would have the access to high quality care that I had.
Well, that's quite a story. So what are you doing there now?
So right now I work in the business development department in the Orthopedic and Spine Institute. So we look at physician recruitment and how to strengthen all of our service lines and build market share to ensure that everyone has access to the quality services that we offer at Tri-City.
And how's baby Lovelady doing?
And baby Lovelady's doing great. She's just over 1.5 years and talking and running and excited to be a kid.
Well, that's a great story. So the next episode's going to have to be the grandchild at Tri-City, I guess, as well. So.
Maybe 25 years from now, that might be a good plan.
So obviously, you have a fantastic story. And, you know, Glenn, I'm sure that this is a story that you've used in order to attract funding. I'm not surprised you're doing pretty well in that fundraising. This is just tremendous. So how typical is this?
Yeah, well, this is an amazing story, and the baby is just beautiful, absolutely beautiful, and we couldn't be happier that there was a great outcome here. You know, one of the things that Janelle touched on, if I may, John, is that, you know, she was a patient, her daughter was a patient. And there's this recurring theme that runs through Tri-City. You know, we've been trusted for generations to provide this level of care. And one of the things I don't think we've touched on yet is this year we're celebrating the 30th anniversary of the neonatal intensive care unit at Tri-City. And so this is a big deal for Tri-City. And every 5 years we do what's called a NICU reunion. And there's a huge NICU reunion for every baby born, whether they be 30 years old or just born, coming up on September 10th. It's also when we'll be doing the ribbon cutting to open the new neonatal intensive care unit. 5 years ago when we did this, over 1,000 people showed up on a Saturday for games, food, fun, and so this year we're doing it again, and we expect probably a bigger crowd than that. So it's just amazing.
Well, that's really exciting. So obviously you've got the financial response. Has this been advertised, for lack of a better word, in the community to a point where you're getting some other types of input from the community on it?
Yeah, we actually did something over the summer, last summer, where we asked if you had a baby born at Tri-City, to share your baby photo, share your Tri-City baby. And so we had hundreds of people respond on Facebook, sending little stories and photographs of their baby. And one of the ones, or some of the ones that really sort of touch your heart are the photo of the baby in the NICU. And then also they send a photo of the child graduating high school or getting married or something like that. It's amazing. You feel a part of something so big and so important in the community. And that's really why we do it, because it has this massive impact and it touches so many people.
So if people are interested, either as a result of the show or other things that they know about the NICU, what should they do in order to contribute?
Well, they can go to our Facebook page and get the most up-to-date information. Facebook is Tri-City Hospital Foundation. They can go to our website, tricityhospitalfoundation.org, or they can simply call our office, which is 760-940-3370. And they can get involved, they can make a donation, they can support our upcoming events, and they can learn more, most importantly, about everything the foundation does. Our foundation board is made up of volunteers that live and work in this community. They're very committed to providing the resources the hospital needs to provide an excellent experience for our community. And so we welcome all donations, all support, ideas. One of the things we didn't mention, John, if I could, is when we looked at this project, the nurses and the care team were the ones driving the design of this room, these sample rooms. You know, what do the parents need? What do the staff need? This was not a decision made by the foundation or by anybody else. This is the nurses saying, you know, this works here, and getting input from former patients. And Janelle was part of that, even looking to the color scheme of the room. This is a collaborative community effort to make these rooms and this experience as nice as possible.
Well, projects built from the bottom up are successful projects. It's great to get user input. I want to thank the two of you for joining us today, and of course I want to thank Sharon as well. If you're interested in learning more about how you can support the Tri-City Hospital Foundation, visit, as we said, tricityhospitalfoundation.org. Thank you for joining us on Community Health Matters, and be sure to join us again. Remember, this show and all other KOCT shows are available as video on demand at koct.org. We hope you enjoyed the show. We look forward to seeing you again.
Community Health Matters was made possible by a grant from the Tri-City Healthcare District Board of Directors Community Healthcare Alliance Committee.